paper in biochemistry, determination of sensitivity and specificity of Chemstrip-Micral test in the detection of microalbuminuria in 24 urine samples in the presence of sodium azide as a preservative. The authors are T.J. Silva and SASC Senanayake from the Medical Research Institute, Colombo, and the Faculty of Medicine, University of Colombo, Sri Lanka. And the paper will be presented by T.J. Silva.
Good morning. I would like to take your valuable 10 minutes of valuable time to present our research finding. Topic: determination of sensitivity and specificity of Chemstrip-Micral test in the detection of microalbuminuria in 24 hours urine samples in the presence of sodium azide as the preservative. Introduction. Excretion of albumin in micro quantities in urine ranging from 30 to 300 milligrams per day is an indicator of early nephropathy. The detection of microalbuminuria in diabetic patients help to prevent the progression of nephropathy. The conventional protein detection techniques are not sensitive enough to detect the microalbuminuria. As you know, in the world, there are several immunological very effective assays were developed. Among them, radioimmunoassay technique and radial immunodiffusion are vital procedures, especially in the immunoassays. The Chemstrip-Micral test is a semi-quantitative rapid test widely used in private sector in Sri Lanka, which is recommended to detect microalbuminuria in 24 hours refrigerated urine sample collected without a preservative. That is my research problem. So this Chemstrip-Micral test is widely used in Sri Lanka, but for the preserved sample, only the preservation technique is refrigerated samples. Collection of refrigerated sample is practically difficult. You think about when we instruct the patient to collect the 24 hours urine sample at home and keep your sample throughout the collection at refrigerator. This study was done to compare the sensitivity and specificity of the Chemstrip-Micral test and in-house radial immunodiffusion test in the presence of sodium azide as the urine preservative. Study design and methodology. This study was designed as an experimental analysis with convenient sample. The patient number is 20. Attending the diabetic clinic at National Hospital Sri Lanka was selected to collect the 24 preserved urine sample with sodium azide. The patients with renal diseases other than diabetic nephropathy and pregnant women were excluded using the clinical history. Further to the study design, the albumin level were detected using both CMT and RID method. The sensitivity and the specificity of the CMT were determined with the positive predictive value and negative predictive value. In a single radiant diffusion, as you know, antibody input into the gel and antigen is measured by the size of precipitin ring. Here, antibody is against to albumin, anti-albumin. An in-house RID technique was adapted in the Department of Biochemistry at National Hospital Sri Lanka in 2002. I'm one of authors there for the detection of microalbumin 24 hours urine preserved with 100 milligram per liter sodium azide. The established method was used to determine the urine albumin concentration in the range of 5 to 200 milligram per liter. Major drawback of this adapted in-house RID method were difficult in performing single test at once and the lengthy 48 hours tedious laboratory analytical phase. 5 to 5 methanol soaked dried glass plates were placed in the horizontal table. A volume of 10 microliter of locally prepared human albumin was added to the melted 4 ml of 1% agarose at pH 8.6 barbiton buffer and mixed well. Agar antibody mixture was poured exactly over the whole surface of the 5 centimeter into 5 centimeter glass plate. Air bubbles formed during the process were removed by gentle flaming or with partial pipette. You can see this is the lengthy process, and then we must wait for 48 hours. Port gel was allowed to sit in moist chamber at 4 degrees centigrade for overnight. Wells with diameter of 2 millimeter wells were cut by gel cutter using a template, and then a cut gel portion were removed by negative pressure suction pump. The wells were loaded with 5 microliter of urine, and the gel was placed in a moist chamber at room temperature for 12 hours. Plates were then stained with page blue 83 and de-stained. The CMT test was performed on all urine samples. The test was done on same day of collection by dipping the test strip until the liquid level appeared between the two black lines. After 5 seconds, test strip was carefully withdrawn without touching the slides of the collection container. The excess urine was allowed to drain. The color of the test pad was compared with the color scale printed on the strip vial, which has negative 20 milligram per liter, 50 milligram per liter, and 100 milligram per liter semi-quantitative detection margin. The sample that had value 100 milligram per liter or more were diluted with distilled water, and the test was repeated. So you can see here how I detected, defined my sensitivity and specificity and positive predictive value and negative predictive value. And then I calculate the false positivity and false negativity of CMT. From the literature said like this: reported sensitivity of the CMT in the detection of microalbumin is 95.1% for 24-hour refrigerated urine sample, and then the specificity is 96.4%. You can see, according to literature, if it is a refrigerated, sensitivity and specificity are within the accepted limit. So this is the summary of my results. 12 patients out of 20 patients were diagnosed with diabetic nephropathy and were on treatment. The other 8 were diagnosed with diabetic mellitus but with no microalbuminuria. Discussion: if the CMT is a perfect indicator, as you know, it would give a sensitivity of 100%. This means that CMT will detect the microalbuminuria in all patients accurately if it is 100%. But in a calculated sensitivity of CMT in the presence of sodium azide was about 92.3. So according to literature, and now you compare with that literature, that is 95.1. So if you use the sodium azide, so then a 2.8 deduction of sensitivity is occurred. And it is a satisfied predictor for the detection of true positive, as false negative rate is considerably low. Specificity of 100% means that all the normal albumin excretion is reported as normal with zero error in reporting. Specificity of CMT in the presence of 100 milligram per liter sodium azide as the preservative of urine was 57.1%, and it was not a satisfied predictor for true negatives. False positive rate was very much higher than the expected 42.8. Both sensitivity and specificity of CMT in the presence of sodium azide as the urine preservative were reduced than the reported value for the refrigerated urine collection. The specificity was affected significantly. The CMT with its negative predictive value of 80% was able to screen those who did not have microalbuminuria in 24-hour sodium azide preserved urine. CMT is a good screening test for the detection of microalbuminuria in 24-hour preserved sample. CMT is not a satisfactory confirmatory test for microalbuminuria due to its low positive predictive value. Value of the CMT must be confirmed by any other recommended quantitative immunological test if you use sodium azide 100 milligram per liter as your preservative. Thank you very much.
Thank you, and now the paper is open for discussion.
Yes, now the refrigerated sample values were higher than the CMT. Sensitivity is 95%, yes, you said. Yes. So, what is the reason you wanted to do this study using the reagent? Is it the compliance is poor with the patients for refrigeration?
The my recent problem is preservation. We can do preservation, it's good. But if we don't like society, so if we issue the bottle, collect the urine at home, so then the patients, they do not like to leave the sample in the fridge. That's the identified result problem. That's why I tried to do the check whether with the preservative can we do this.
Thank you. It's a very clear presentation again. Are there other sorts of testing strips available? Is CMT the only one available in Sri Lanka?
No.
No. Is it the only commercial testing strip for
The
microalbuminuria?
commercial strip
Is it available in
for urine, but that's available in Sri Lanka.
Is it the only one? Are there alternatives?
Yeah.
So, are you going to go on and test the alternatives?
Now, are there any alternative strips other than this one?